PM. And this is the January meeting for the Platte County Health Department Board of Trustees. Can we, let's open with the roll call.
Zach Gronke's here.
Tim Swaney here.
Susan Cole here by Zoom.
Kingsley here.
Okay, let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the States of America
and to the
republic
For which stands one nation, under God, indivisible, with liberty and justice for all.
Okay. Introduction of guests and public attendees. Do we want to go ahead and introduce?
I'll say we have Dr. Naomi Jamal from Home Health will be joining us today to give us a little bit of an update. So,
Okay.
welcome.
Would we like to go ahead and have her do the update now, or do we want to do the minutes from?
we can do the minutes
Okay.
first.
All right, I know she drove a long way and probably doesn't want to hang out for the entire duration of the meeting.
We could move her to the end, but she always likes.
Probably
She's
would
a
love
good
that.
closer.
Yeah. definitely a
Good
good closer. Okay.
I tried to get it in the queue, so I know that was a big task to speak through, but yeah.
Would anyone like to make a motion to approve the minutes from our last meeting?
Yeah, I'll make a motion to approve the minutes.
Can I get a second? Or
I can second.
Okay, Sue, second. All right, we'll go ahead and vote. Zach?
Yes.
Kim, yes.
Sue, yes.
Yep, yeah.
Okay, all right,
Minutes are approved.
minutes approved. Up next, Dr. Jamal.
Good evening, board members. Thank you so much for having me today. It's a pleasure to provide this update. As everyone knows, Platte County and Swope Health developed a partnership. I think it's almost a year now, so time certainly does fly. As we were looking through our data, saw that we almost had about 4 quarters worth of data, which kind of tells you that we're almost at a year's mark. And from our perspective, it has truly been a really important partnership, very community-based, very focused. From Swope Health's perspective, it was always something that we felt that there was a lot of alignment, not only from a mission and vision perspective, but what the county is attempting to provide in terms of access and quality care. The health departments, their focus on that very much aligns with what our focus has always been as an FQHC. That has really been in the Northland area for well over a decade, in fact, close to 2 decades at this point. The Platte County is just a continuation of that expansion and our ability to continue to be accessible to the residents of the county. From our perspective, as we look at, I'll just kind of divide things from an access perspective. That's what we call productivity at Swope Health. We really got to think about it as in terms of access. So in fact, we even call them access numbers. So from our perspective, our goal has always been to hit about 16 to 20 patients a day. This is through an 8-hour clinical day. Obviously, when we first started out, those numbers were a lot lower. We kind of were almost averaging about 9 or 8 in the full day, which is expected. We did end the year averaging a little bit higher, not quite at goal at the 16, but certainly I think we averaged about 12 patients a day. So we did see that improvement. Some days, in fact, where I say 12 because we're still seeing a bit of feast or famine type of thing, right? So some days they're seeing 17 to 19 in a day, and then other days they're dropping right back down to 10 or 11. So when we kind of average it out, we're looking at about, and this is in primary care, we're looking at that average of about 12 patients a day. We did introduce a dental hygienist to the clinic over the last several quarters. They're here about once a week, so about 3 to 4 times a month. That practice hasn't taken up as well as we were expecting. We're really only seeing about 4 or so patients a full day, and we would like for them to be at least at 8. So obviously the productivity is not as much in primary care, but they're about not really where we would like to see them, and certainly not at a point where we would introduce more days. So from our perspective, certainly something that we're working on and looking at to see where the gap is, whether there are opportunities for referrals. Some of the things that we kind of spoken about previously even was the fact that our Riverside clinic is here and kind of so well embedded, and a lot of the patients are now getting to know that clinic. I wonder if they're just going there for their dental needs because that's a full operatory. So that's just something for us to kind of think through and figure out, what opportunities are there in terms of increasing those numbers. Second thing that we obviously look at is clinical quality measures. And so from a clinical quality measures perspective, we're really seeing, again, it was a newer clinic, a newer practice, so a lot of these patients were brand new. Most of the patients were new established care. So from that perspective, they're not quite at goal, but certainly further along than what we would expect for a brand new patient panel. And the other thing that we look at when we think about quality at Hope Health, that includes patient experience scores as well. So we have been sharing our patient experience comments, largely positive. I think Dustin had requested that we also kind of break those down, especially in this update, in terms of the actual score as well. Because what we share on a regular basis are qualitative comments, but they're really looking at the quantitative element as well. So in terms of our patient experience, we actually have a system that is called Q reviews. And so every time a patient has a visit at Hope Health, including the clinic here, when they check out, they get an immediate text message that goes out to the patient. That text message has about 10 structured questions. Those questions are all about provider interaction, the facility, how the MAs interacted, the front desk interacted, the ease of getting the appointment, wait time. So it really looks at the entire visit, whether they would recommend the clinic and the practice or their visit to family or friends. That's really looking at the NPS score. So it's very well thought out and broken out. And then we also have the ability for them to leave comments as well. So those comments that you see are shared from there. The questions that they have is on a Likert scale of 5. 3 out of 5 is what the questions that we ask them. So they entered the score for that last quarter. Our goal is 4.25 out of 5, which is about 85%. So we expect about an 85%, that's what we consider positive feedback. The clinic in the last quarter ended at 4.72. So really, really high, probably one of our highest kind of scores. Most of our clinics do really well and meet that goal of 4.25, but this clinic was well above that 4.25. And across the board, kind of doing well on almost every single measure. So we're very, very happy with the patient experience scores that we're getting. The response rate, even industry-wide, we consider an adequate response rate to be anywhere between 12 to 15%. And the clinic ended their average response rate for the year was at about 12%, which is pretty much where they should be when we look at industry standards in terms of people actually responding to surveys. That's pretty much everything that I had. I know I went through that fast, but wanted to pause and see if there were any questions.
Yeah, so I know one of the things we brought up was just like how you guys are liking the clinic over there. There are things that you guys have felt like have been lacking, or anything that you're specifically getting staff feedback about.
I know from our perspective, our staff really, really likes it here. We've been able to get a stable provider. So I think that stability, even that increase that we're seeing in numbers, the patient experience scores, things of that nature, I think a lot of that has to do with the fact that we've been able to at least get provider stability. So it's been the same provider this entire year. She does well with the patient population. The good thing about that provider is that she also does a day a week if we can help. So she continues with that continuity if there's any overlap of patients. So from our perspective, the team really, really likes it. Finding the health department staff extremely responsive. Anytime. I think initially, obviously, there was some growing pains, but that was to be expected and nothing major. And I think since then, we've kind of developed a really, really good working relationship with the health department. From our perspective, at least.
So one thing I do have, and that is, and I was going to talk about it during my report, but I won't make you stay the entire time. But one of the things that we have started is we started some digital signage. So in our waiting rooms, and we're going to have some others throughout the building. But you can kind of see one of the things that we have advertised.
Absolutely.
And so we didn't have a meeting with Swope this week, but you might tell your staff if they want to advertise the dental, or if they have other slides they would like us to put up. We've gotten some pretty good feedback from the people just in our waiting room.
Yeah,
So we are happy to put that up. Hopefully that will, spur some other, because we
absolutely.
kind of have a captive audience for a little bit. And honestly, it looks pretty cool.
It does.
Yeah.
We appreciate that. Thank you.
So it's like a slideshow that'll play through, and we would have like some of our stuff, like QR codes and for as well that are coming up.
Yeah.
We can promote some of that stuff that way as well.
We appreciate that. I'll definitely make sure, because I did want to mention one of the things, and I'm not sure whether we've shared that with the board, is the back to school event that we did. That was even very, very successful. So our entire clinical team came along with the pediatric. We had additional pediatric providers come through as well. I believe they did about 40 to 50 back to like a number of encounters in that single event. And so that is something that our team is very, very interested in continuing and making an annual event. I do believe that we got some pretty good feedback from that.
And I think what the next 3 slides are just glamour shots
Yeah.
of her, right?
Okay.
I thought you were saying you and I, but well,
And of us.
Very nice. But yeah, I mean, I know just for myself, I'm obviously not speaking for the board, but I think, having a solid working relationship with you guys and getting reports, updates every, 6 months or so, this is going to be something that will help us to, continue to have a good working relationship with you guys and keep everything hopefully just flowing well and keep your numbers up. And if there's anything that we can do to help you guys,
We
feel
appreciate
free to
it.
reach
Thank
out
you.
through Justin and let us know.
Yeah, you have a very good team here.
Yeah,
Yeah.
they're the best. So
Yeah.
we take pride in
Hey,
it.
Dr. Jamal, it's Dr. Kingsley. So thanks for coming, by the way. So what do you guys do for marketing purposes to kind of tell people about what we have that you guys are providing services wise at the health department? Do you guys do like YouTube commercials or X commercials, or where do you guys go to kind of to let people know what you guys, especially like the dental assistant, the dental hygienist or whatever? I mean, that's a key thing, and maybe if you can reach the public that way or something, let them know, because I mean that's a huge thing. If somebody knows about it, I'm sure they'll start coming. So.
Yeah, no, absolutely. And I will say that beginning of the year, this is when our communication team really kind of looks at that, not only for the Platte County, but then looking at this very, very closely clinic by clinic, to kind of really see where are our gaps, where are opportunities that we can kind of take advantage of. So I do know that I will touch base with the communication team to kind of really get a better idea from them. But I do know that our chief communications officer is certainly going through that exercise right now for all of our clinical sites, because now we've identified which services are doing well, which services we kind of need to kind of advertise for a little bit more. I think traditionally, I do know that team does a lot of pushing and advertising on social media. So not only traditional LinkedIn, but and our website, but we're talking about Facebook, Instagram. So they do quite a bit of advertising through those means. And we've at least found that for most of our other clinics, when we first go into a community, we do a lot of the sending flyers and things of that nature. But we found that, a lot of people are now responding much, much more to what they're seeing on social media, especially, I think, the age demographic that we serve here. Some of our other, clinics heavily skew towards 65 plus. Maybe they're a little bit more traditional in how we do outreach there. But certainly our age demographic that we see here, we feel will respond a lot better to social media. So I will, we definitely can kind of take that back to our communications team. I do know that is something that they're looking at quite closely now, but wouldn't be able to give you details on what their plan is for 2026 yet.
And any social media posts that apply directly to the services that are provided here, we are happy to push those out through our social media outlets.
We appreciate that, and we can Justin probably get you connected with Bridget Locke. She's now our new chief communications officer. So she is now over that entire department, and so she would definitely be able to. Thank you.
And during our last few meetings, but we have started since August doing our own customer satisfaction survey. And of course, there's crossover because there's QR codes throughout the building. And so sometimes slope is mentioned. And so we've been passing those results along too. So since we've started, I think it is primary care slope. It was mentioned like 5 times. So we have always passed those on to, and some of the biggest benefits are always like the comments. So we always pass that on.
Yeah, no, we appreciate that. Thank you.
So, Dr. Jamal, have you seen what our scores are for customer excellence and such? Have you seen what the surveys have shown?
So just I'll help. So since August 1st, 97 out of 104 have rated us 5 stars, or how would you rate our service? 7 4 stars. How easy was it to use our services? 100 or 98 5 stars, 4 4 stars, 1 3 star, 1 2 star. Dr. Kingsley beats me up about that. How friendly and helpful was the staff? 102 5 stars and 4 2 stars. So
it's almost impossible to have that kind of scores. I mean, you got to remember, we're essentially a government entity. Everybody hates government entities, and the fact that we have customer service scores that are of that magnitude is incredible. And Swope is part of that. I mean, they're coming not just to see us, but they're coming to see you guys too. And so we're getting all this feedback. So whatever you guys are doing is doing great. I just think you need to get out there and just really engage the public more, get more people involved, let them know what the services we have. And I think I know Riverside, like you said, is doing really well, but I think if the word gets out, we could probably overtake them easily. With that kind of customer service scores, we're going to do really well.
How many days a week are there a dental hygienist at Riverside?
Every day.
Every day, okay.
And it's not just a hygienist, it's a dentist.
Okay.
And it's a full-blown 5 operatories and it's also a very, very established practice. I think some of this is also that we are building a practice from scratch there, and that is a fairly established practice. So I do think trying to compare a decades-long practice to one, that we're just getting off the ground, we knew that it wouldn't. We expected to be further along, but I do think that some internal recalibrations line when we're trying to take a look and seeing what the opportunities are. And we'll certainly kind of bring the health department staff in once we've done our own internal kind of review of figuring out why those numbers aren't where they are. We are kind of certainly found that since moving here, interestingly, and kind of embedding in the health department, I do think that we are seeing more Platte County dental patients at the Riverside Clinic, if that makes sense.
Sure.
Which is why I feel like I don't think it's not that we're not serving the population. I think they're just being served at a different location. Is what's happening. But so we're still kind of really reviewing that data. I couldn't tell you for sure, but early trends seem to indicate that's what's happening. But we would certainly kind of, once we do our own internal review and know for sure, we'll certainly share that and kind of work together to try and get these numbers up.
I would wonder what kind of routine kind of cleanings and things like that wouldn't require a dentist to see them afterwards that could probably be seen sooner, getting up here if Riverside were to.
I will say that our dental hygienist, so this embedding a dental hygienist inside primary care clinics, we have had a lot of success with this at our pediatric sites.
Sure.
The idea there is that the kiddo comes in for a well child check, leaves with their dental preventive care same day.
Yeah.
They're not coming back for that. And that has been very, very successful for us at our pediatric sites. So I also wonder if some of this is just that this is PAM-Med and it's not pediatrics. But again, certainly something that we are still kind of looking at and seeing. But this model has served us very, very well in our pediatric practices. In fact, I will tell you at our central location, dental is upstairs and our pediatric clinic is downstairs. And we have found that we had to embed a dental hygienist inside the pediatric clinic because patients were getting lost even just going upstairs. Like they weren't even doing that, they're out. So we were like, okay, we're going to embed even in the same building. We have a hygienist embedded inside of the pediatric clinic, and it's worked really, really well for us.
I appreciate it.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you for coming. Bye.
All right, Andrew, you're up.
So it being January, we have our full numbers for the year. We did 7,577 birth and death certificates. Was 2,211 people coming in for birth and death certificates. That is the most that we have done. And Cindy and I were talking about just the number of people and the number of people that we've served. So that has been the most that we have seen maybe ever. So, and if you look at the history of the past 5 years, that's 10% more than anything we've seen in the past 5 years. So pretty good traffic coming in, lots of happy people coming in, giving a lot of good service, obviously, but pretty wonderful to see in the big scheme of things. Just a really nice facility for people to come in. I think they are, you know, it's bright and clean, it's easy access to come park, just easy to find right off the highway. People love coming here, and you know, great facility. So I say that pretty much every time, but it is nice to see a full year's worth of data. I think the first couple years, people are trying to figure out where we are and that kind of thing. This year, we had all those excuses kind of taken care of. This is what it's probably going to be like from here on out. We are still working on our HVAC thing. But and that work will continue. We are getting closer. As you can tell, we're not freezing, so that's good.
It's true.
But we are still having some issues. So we're obviously not having cooling issues, but we are having some issues with the heat on occasion, particularly as we get these wild swings of 60 degrees to 18 degrees over 24 hours. So, and we actually need it to be cold for longer than like a day or two, because we need to know why, like, some of the heating isn't heating. And so it's really hard when they come back out, and then it's over 32 degrees. They're like, it's heating great. Well, yeah, it is heating great, but not yesterday when it was 4 degrees. So
You still have February.
yes,
He'll get some more chances.
kind of the new thing I mentioned to Dr. Jamal is, and it's been in the works for a while. Jill, our new marketing specialist, I don't think she's even known how long we have talked about digital signage. She's like, I dreamt up this plan for digital signage. Aren't you proud of me? And I'm like, Jill, that's not exactly new. She has her implementation. That's her. She deserves all the credit for that and the slides and stuff. But the idea of having signage throughout the building to tell people about stuff, I think that's something we've talked about since we moved into the building.
Yeah.
But our first monitor has gone up in the clinic. And as you can see, it's in right by Dolly.
Yeah.
I did
And-
notice Dolly.
Yeah.
It has probably 20 slides, including like the weather and different things. It even has a QR code for the survey, but the patients love it. It gives them something to look at.
Sure.
They're asking questions. It's not interactive, but it kind of is because they're going up and getting the QR code. Has stuff for harvesters, has stuff for, does it have stuff for the diapers for Happy Bottoms?
I'll double check. But one of the nice things, it's very easy to change things out and get something new added. Or you can even program it like for specific days of the week. So like, say, Harvest Thursday would be the next day, you can like really make it pop up more often to where people are actually seeing that more and more and are able to get that like really drilled in their heads. I think the goal is like keep content to loop like within 10 minutes, about the average time someone would be like waiting out.
But it has like our holiday on Monday on there.
Good.
Sure.
Yeah, that's good.
That's
advice
good.
for 'em.
So
How many
we,
more monitors are you planning on putting up?
we will have one in Wick. And then our front entry, we are working on some sort of solution. It's a little bit of a difficult area to manage where people can see it. So, Doc-
Coming down from the ceiling up there.
you know, Dr. Kingsley and I did a little field trip around. I don't want to reveal my splendid, great idea because he thinks all my ideas are terrible.
Yeah, I wanna.
But I have a pretty cool idea and I'm gonna spring it on him later.
VR goggles, so it's just,
Oh.
yeah, they
Now,
swing your
that
head
is
and
a cool
get chilly.
idea.
Yeah, no,
We do use those where I
You
work
do?
now. Yes,
I
for
do not.
patients. They come in hypertensive and they have like white coat hypertension.
Ocean scene. Oh, sure.
They actually do help.
That's awesome.
Kind
And
of
I'm not that high tech, so I love that idea.
These are ones like phobias
PTSD
and public
patients.
speaking or like just things or something, whatever.
So
Nice.
that'd be awesome. But
Maybe we can get Meta to sponsor us.
There you go.
so revenue at the end of the year, we were at 103% of our projected revenue. And we spent 99.95% of our projected expenditures. So we spent pretty much every penny. And we actually, with our if you look at the budget report, you will see that we, on our revenue that was over, we actually made our transfers for this year reserve funds out of those overage because those weren't in the 2026 budget. We made those out of the overages for the revenue. So we ended the year spending everything that we had in that budget.
Where did the extra 3% come from?
Basically, when we do our budget for the income, our hands are kind of tied on what we can budget there. We don't really get to guess on anything. So we don't get like on our tax income, we get to put what the county and the state give us. We don't get an estimate on like past due amounts or anything else. And there's always those amounts. We know that there's going to always be more, but we don't get a budget that way. So like this year, I can almost guarantee our income is going to be more than what we budgeted.
Yeah.
Almost, yeah. But we can't budget that way.
Yeah.
So that's where that came from. Does that answer your question?
Yes, it does.
Grants and contracts, those are almost always what we have. Now, we do have one in particular this year, but we don't know exactly what it's going to be, so we'll see. But we do know on the other stuff that they're going to be more than what we anticipated. Our money market account, we are at 794, 705, which is about 432.87 less, but then we knew that was happening all throughout this year just because we've allocated money to reserve accounts and different things. We're about $200,000 less in our balance for our lease purchase, so that's consistent, just paying it. I mean, that's about how much we're paying it down, so. And Dr. Kingsley's favorite parts, and we talked about this with Dr. Jamal, we had 12 people submit responses. And we do have a new thing we're doing. We'll have a social media post go out maybe sometime next week, but our person who won the gift card in the drawing, they agreed to take a picture. So there'll be a social media post with their gift card and just talking about them winning and to do the drawing or do the survey when people are in.
So they already actually went out today,
Okay,
so they already shared that. So
so he was happy. And I kind of already went through this while Dr. Jamal was here, but this month, all 12 5 stars on how would you rate our service? All
Wow.
12, how easy was it to use our services? 5-star. How friendly and helpful? All 12 5 stars. My favorite part, comments. What did you like about our visit? Everything. Nurse Jackie, amazing, so kind and good at explaining everything. Nurse Jackie, extremely kind. Front staff, quick and friendly, professional and helpful staff. It was great. The conversation with helpful resources and the future of my pregnancy and after delivery. What can we do to improve? Nothing. Everything was wonderful. You're doing great. I was happy with everything. Great job to the men and women of the Platte County Health Department. Nothing comes to mind at the moment. And in sharp contrast to last, that's while waiting. So clearly we cannot please everybody.
Right.
And I will turn it over to Taylor.
All right, so since we turned in all of our accreditation documentation, we've just been getting ready for the next steps with that. So we've been meeting with some other health departments to just see what their site visits were like and getting some information from them. Also, through the documentation process, we kind of came up with a lot of different quality improvement projects that we want to do at the health department. So we've been working on a list of those and trying to figure out priority levels because we have a lot of things that we want to target. So, and one of the big things is the policies and procedures, which I think we've mentioned before. Another one of my goals this year is to kind of shadow some of the different departments and learn more about the areas that I don't have as much experience. So I went on a daycare inspection in December. And so one of our newer environmental public health specialists, Rachel, is also in the process of learning how to do the daycare inspection. So we had someone from the state came and did an inspection. So we both shadowed him. So good way to learn more about all of our programs. I think we had mentioned last month that Andrew and I attended the Governmental Public Health Summit. They had lots of really interesting topics. Everybody's kind of covering AI these days. So they talked about AI. They just also talked about funding, staff wellness. And I think one of the most helpful parts of that conference was that they had a lot of people from other health departments who did little mini sessions. So it was a lot of just like question and answer, and you could talk to people and get ideas. So we did get some different ideas about different things. We had talked with, I think it was Taney County, who has a really good environmental public health training program, and they shared some of their resources and things like that with us. So, and also Dr. Kingsley, or not Dr. Kingsley, sorry, Dr. Chape and Andrew did one of the sessions and spoke about board and health department relations. Also part of that, they just, oh, yes.
Can you go up to the pest control? Up. So it says we've potential new pest control agencies. We've had issues with pest control. It at our building, or just when we're trying to inspect other buildings, or what is that all about?
Within our building, so we had some spiders. I think we had mentioned last month there were some spiders,
Right.
just like tiny little spiders back in Slope. We had some little, I don't know if they're not scorpions, but just little slithery creatures.
Like centipede kind of.
Yeah, centipedes. Yeah, okay, thank you. I was like, not a scorpion. I'm the wrong family, but yeah.
That's in
Anaconda.
Arizona.
Be a little bit scarier. But we had looked at a few different pest options, and our contract is up in, I believe it's April, so we are planning on switching pest control companies when that is up.
Okay.
We decided that last month, I think, didn't we?
Really tough.
Yeah.
Yeah,
Discussed, I think, yeah.
Okay.
Okay. Keep going. Sorry.
And then also Andrew and I attended a grant management training. It's one of the requirements for incentive funding this time around. I think we've talked about the state has been doing incentive funding, and a lot of it is related to accreditation. And this time they threw in a grant management. They have little different things that they throw in there. But we attended the first session, and then there's a second session next, or in the upcoming months. There's 2 more options for sessions. And I think we had mentioned, I think almost all of our leadership staff has now gone to the Emerging Leaders Academy. And this past month, Rebecca, our Accreditation Quality Improvement Manager, Bailey, our Environmental Public Health Supervisor, and Paige, our Administrative Services Supervisor, completed that training. So we attended their graduation. I think that was pretty successful.
And I guess one of the things that struck me is they actually encourage family. And I don't know if Paige's family came, but Bailey's little son came, and her mom came, and I think her sister came too. So it was, it's just kind of fun to see families come to celebrate their successes. So and Taylor's mom came. But Taylor's mom plays pickleball at the place that the graduation was held. So cookies.
We went and played a game of pickleball.
It was funny because she just happened to be playing pickleball that day and was there at that time. Perfect. So she stopped by.
And took a bunch of free cookies.
I think she had one.
So just make sure all people that graduate from that make sure they put that on their resume. Take advantage of that.
Yeah, definitely. I think I mentioned last month, the Northland Health Alliance is doing a fundraiser for, part of the funds will go to the NHA Healthy Foods Task Force, and part of the funds will go to Feed Northland Kids, but that's on February 1st at the Embassy Suites, right here across the street, pretty much.
Down the street.
Yeah. So
And just so everyone knows, that is a Sunday. I did not realize that was a Sunday when I bought my ticket, Taylor.
So are we putting up our own little booth there, or what? Or are we just invited to come and see the event, or what actually what is our role there? Yeah.
So it is a fundraiser. So your role is you're invited if you would like to donate and come. You do not have any obligation to do so, but I felt like I had to donate and go, but then I realized it was Sunday. So basically Taylor conned me into donating again so my wife could go with me. So instead of one $50 ticket, she got me to donate 2 $50 tickets. So good job, Taylor.
Hey, whatever works. But it's essentially kind of like a brunch event. Lots of different restaurants in the Northland are participating and donating food and drinks to it. So there's going to be different little food samples of different kinds from different restaurants that are around here. So.
So do you go, is this just, you can get a ticket online if you would like to? attend? Okay.
Yeah, and I think I sent that out.
Mhm.
Yeah,
a
that's
week
right, you
ago.
did. Okay.
Let me know if you can get it.
Yeah, okay.
Are the restaurants competing against each other for like prizes or anything for the best food, or is it they're just donating the food?
I don't believe so. I'm not super involved with the planning of it, but I
I think
think
it's just check them out and like try to sample some of their offerings, and then maybe you'll go and visit
Their restaurant.
their restaurant and things like that.
Would you like us to get you a little sash that says judge?
I mean, we could ask. Um, also, so with health ed, we had given out some of our MCH grants, the maternal child health grant. We have money that we give to the schools, and the schools do different mental health prevention campaigns, as well as vaping prevention. We also had a community advisory council event this month. And then I think I mentioned this last month, but we had received a few donations, and most recently received a donation from the Phil and Mary Pattinson family to help fight food insecurity. So we've been seeing a lot of higher numbers. We've seen high numbers the last several months at our Harvesters events. But yeah, we've had a lot of need for that. So yeah, any questions?
And we have been struggling a little bit with, they've had some staffing changes and some instability with their truck drivers at Harvesters. So we've had some inconsistency with when the truck is getting here. And we have people show up quite a bit early for when it's open. Well, that really poses some challenges
Can't get in.
because we can't let them line up because we need the truck to be able to get in. So we've been working through that. We are trying to strategize what we have. Tricia has a meeting with Harvester. Well, Tricia and Taylor maybe have a meeting to talk about, you know, can we have them deliver the day before? With perishables, you can't do that, but if we have other, so we're trying to work out some ways we can do some things because it is really causing us some problems with traffic control. This past Thursday, what was it, last Thursday, I guess, it rained. So it rained hard. It was pretty, I mean, I was not out there. The other staff that was out there, Andrew Carpenter, Frank Atkins, Tricia, and probably some other people. Of course, we have some rain gear, but we're getting them some better rain gear. But they were soaking wet and they were very challenged with what they were having to do. So hats off to them, but it's a challenge to manage all those people. Now, the people in line, they were champs. They were very patient. They were very pleasant about the whole thing, but it is challenging.
Yeah. As far as the perishables go, is it are you guys allowed to have a refrigerator if you were to get it a day earlier? Is that something where there then comes liabilities with, it went rancid overnight?
The joy of being a health department is that we know all the rules about commercial refrigeration. And so it's very expensive to have commercial refrigeration. So it's just not really cost effective for us to do that. So no, it wouldn't be. And I guess the other thing is we do the Harvesters as we are not, the health department is doing this as an exercise, a monthly exercise to practice our distribution of, you know, if we were to have a public health event. So we do it as an exercise that we also do great things for the community, but we are not really in the business typically of doing like food distribution. So we combine it. So that's really not we do it as a shared thing. You know, if we're going to do the one, we can make this other thing be a good thing. So we're trying to do the two birds with one stone thing. So, but easily get kind of lopsided on the expense if we were getting commercial refrigeration and stuff.
The short answer is no. Yeah, I got it.
They give us like giant pallets and pallets of food, so
Mhm.
it's like, it's usually around like 5 or 6 pallets that are very hot, so it's a lot, so.
So if we had a huge walk-in refrigerator
Sure.
or a reefer truck that we kept on site,
Mhm.
it's just really cost prohibitive to
Yeah.
do that.
And we're trying to look into options of like, if we were to get more just shelf stable things, like
Mhm.
potatoes and apples and things that we could keep in the garage, but that might be
Well,
difficult.
and her suggestion of her getting a CDL and her own semi,
Like,
I'm like,
I
do
know.
you really think that's practical, Taylor? And she's like, well, yeah. She's like, I look good in the big rig. I don't know if that's practical. So we're looking for solutions, some more plausible than others.
Going on to my report.
Dustin had enough.
Yeah, I'm trying to help Kim out. So if you wanted
I
to
appreciate that.
try to get back on track. So,
Appreciate that.
the biggest thing is like, at the end of the year and first of year is like when the vaccines for adults and vaccine for children programs are going through recertification. So working on getting that finalized, sending off, preparing for our back to school clinics. We'll be going to Parkville school districts, still reaching out to some other schools, but that will be a lot of our February business that we do. Once again, partnering with Parkville School District, they'll be here shadowing all of our employees. They had a really great time last semester. We're hoping to capture that magic again and continue building that relationship. We actually had they had like some different criteria for like going into the hospitals and shadowing to where they used to get the 2-step skin test, but they're now required to have like a TB blood draw. So we just had them come here. They did their little class and we just had them come in like little small groups back to the lab, drew everyone's blood and got sent off and results like that. So it's kind of going with Andrew says, like people love the building. It's nice, it's clean. They were just the truckers had never been here before, so they were just blown away by the technology we have and then how great the building looked and just how easy the process was. So that was pretty fun. Our nurses continued to finish all like the daycare options. We got all of this completed. Continued management for all of our TV and lead cases. We just switched over to like their new web-based program. I know there's been like some growing pains with that, but they're still working through it. I think it's just because in December it switched to everyone being able to access it. It kind of slowed the browser a little bit, but they're working through all those kinks. And then as Dr. Kamal kind of gave an update about SWOPE, I actually found out earlier today why we didn't have the meeting yesterday. Their clinic manager had like a family emergency come up, so I wasn't able to get all the data for what their comments and those things were. But she said she'll try to work on getting those to me. Once she does, I'll send an email onto the board so you guys can have that.
sounds good.
But that's my report. If anyone has any questions.
Yeah, that's 2 questions. So number one, so getting into clinic services where it says case management of lead cases, have we had a bunch of lead exposures or something?
No, we've always done this. I'm just trying to add more just so you guys are more aware of what we're doing on a day-to-day basis, how we have those. I think there's 22 open cases. Now, what that kind of entails is it's not like a lot of them are like following up from like their provider like every 3 months or 6 months. There's that whole algorithm depending on what their levels are and when they've last tested. And then the states kind of switched like their program for reporting a lot of these things to show me wool care. It's a little bit trickier than the program we were used to working on because we could go in and actually close out cases once they reach like their therapeutic levels. We don't have that access as easy to do anymore, so it has to go through some more steps. So there are some cases we have that are open, but the clients are no longer in a high lead level, like they're in the therapeutic zone, and we could theoretically close the case. We're just not as easily able to do that. But I'll actually have I don't have an accurate number for this month, but I'm planning on adding those to future meetings so you guys can see how much we have and go down with those.
Okay, and then the second question is we had 4 active TB clients. 3 of the 4 have moved out of the county, but 1 stayed. So what happened to the 3 that left, and what are we doing with the one that's still around?
So the one that's still around, we just how we do with any other active case, we do like their case management. They come in regularly to get like their, we get, eyes on them, making sure that they're not having any adverse effects from their medication, making sure they're following their treatment. They do electronic direct observation therapy. So like the video recording of them showing the medication they have, stating what it is, showing the labels and taking it. And then our nurses will verify the videos and check them off and track them on that. The jurisdiction changing was actually a very unique situation we haven't really dealt a lot with before. It was like around the same time we had about 3 different individuals who moved into the state of Missouri and then very quickly had moved out. A lot of them were kind of like work construction, so they kind of go where the work is needed, and most of them had come here for work, and I think they're now one's in California, and I forget where the other 2 went, but one in particular, we actually had a lot of trouble with the places they had been previously, so they weren't getting the best care and weren't getting a lot of good information and were very reluctant to actually get treatment, especially for other members of the family who had latent tuberculosis. So I think our surveys speak for ourselves. Like we take really great care of people here. So we're just working on making sure that they have a little coverage as they move, that we're still kind of making sure that they have their questions answered, that their new doctors are getting the information, they're continuing their treatment, and that they're being well taken care of. So that's pretty much where that's at, if that answers your questions.
Yeah, as long as we're not spreading TB all over the world.
Yep. We're watching it, trying to stop it as best we can. So.
Yeah.
And one of the things that I always complain to Dustin about every month is the money we spend on translation services. But then one of the things of why we do so well, particularly with some of our TB patients, is because we spend money on translation services, because we have our AMI, or not AMN. AMI is like a music service, right? So we don't play music for them, but we have the AMN video service translation, and it really helps to have someone who can look at them and talk to them and make sure that everything is being understood. And so I think that little bit more investment helps with the whole process. And we don't have to do that for perpetuity, but for those first initial visits, when there's not good language, where there's a language barrier, I do think it helps us get off on the right foot.
And that was where one of our big cases that was an incoming jurisdiction and then moved out of it, that they had a lot of language barrier issues at their other places and weren't getting that same level of care. So they really enjoyed being able to ask those questions and having we were able to give them really good solid answers and kind of build that trust and rapport. We were able to get, partnering with school and having Zara actually see these patients and taking care of them. I think just working together like that really, really helps out and builds that trust. And I believe we're able to get more of the family members actually willing to come in, get their blood taken, doing the LTBI treatment and things like that. So
it makes all the difference. So I complain, Dustin, but I also understand why it's important. So.
Okay, thank you.
Rebecca?
Yes. Can you all hear me?
Yeah.
Yes.
Okay. So for this month, or looking back in December, as soon as we submitted for FAB accreditation, FAB actually sent out a survey and asked for feedback. And luckily for us, we had just been through it. So I met with each division and we gave that feedback on just about every measure, whether to keep it, change it a little bit, refine it, etc. So that hopefully is going to allow for FAB to refine their process, and they're going to have a new version in 2026. So we wanted to be a part of that. Next up for accreditation next steps, I did get an email from our accreditation coordinator, and they said they are reviewing the documents. At first I thought, oh, 90 days, 90 business days. That's like 4.5 months. But that said, it could take up to that long. We have also heard from another health department in Missouri who submitted the day before us, I believe. They've already gotten their feedback. So who knows? But we're preparing like we're going to get it sooner rather than later. Moving down for as far as quality improvement projects, I think Taylor already touched on this. And we're prioritizing now that we've seen how many different projects we need to do to make, this continually improve the health department. We're prioritizing what's first, how long is it going to take, and what we need to do to make these things happen. Taylor also touched on policies, so I'll leave that there. Below sorry, my screen is over here. I'm not just looking off into the oblivion. So I realize I should have said that. As far as key meetings, I'm working with the Missouri Public Health Institute, and we're going to create an entire resource library for all FAB required documents so that it's easier for other health departments and we can pave the way. It's basically me and 2 staff members there who are starting that charge. Additionally, I'm meeting with other states, including today. I did a presentation on our lessons learned and making sure that we're helping other health departments in Missouri, also Kansas and beyond as much as we can with timelines and everything. Let's see here. So I know they mentioned the Harvesters event, and we don't just use that to give back to the community. We also use that towards our public health emergency preparedness grant. I think it was touched on earlier. We basically practice each month. If we need to give out a large quantity of whatever to the public, we practice how we're going to get the cars in and the cars out effectively. I think that was a big lesson learned for health departments in COVID, that we want to make sure we're doing a good job there. And our new emergency response planner kind of did his first one, and it was pouring rain, and I think he did a good job. But we're going to continue to refine that process. So in the future, we need to hand out what have you to the public. We're prepared and we look competent and ready. Down to epidemiology and disease reporting. I don't think that I need to show you these numbers for you all to understand that their flu cases are higher this month. Let's see, I think we looked at 287 reported cases for this month. And I spoke with our epidemiologist and looked at the data, and basically the number of cases has gone up. And in some places, it looks like it might have peaked. However, the CDC says that generally right now we're reporting the dates between Christmas and New Year's, and often there's a lag in that reporting. So while it might look like we've peaked, we may not have peaked with our flu numbers for the year. And the reason why it might seem that it's a lot this year is because there is higher than normal activity. They're still calling it a moderate flu year. However, our area went from low to very high in a week. So that means once it hits all at once, obviously more people need care all at the same time. Let's see here. I think there was a question maybe from Zach earlier, is like what we are doing as a health department. Our epidemiologist sends out updates quarterly. So in October, it was about our flu vaccine clinics that we were having for the public, and it was about how to protect yourself from flu and more resources. And then additionally, she just sent one out talking about the higher flu activity and more things about how to prevent and stay healthy. Additionally, she gives guidance to schools and childcare facilities. They lean on her a lot. I know when I went around as a health educator, they'd always ask me how Erin's doing and say to give her best. She gives guidance on all kinds of communicable disease, and they all really appreciate her guidance. And then we've done some social media campaigning. Taylor, if you want to cue it up. I don't know, I think some of you already got to see this, but we put out a public service announcement.
Hey, Andrew, the Golden Globe for your performance is in the mail, I'm sure.
I'll just add it to the others on my mantle.
So we're trying to reach the public in a number of ways. Additionally, I know we do hand washing classes for preschoolers in October, but several of the daycares have asked us to come back and run that class again. So we're bringing out Mr. Jeremy to take back to the schools to remind our kids exactly how to wash our hands. That and we're looking at other options for how we have, I think, some flu vaccines still left. You know, can we go take it to the public? Where can we go and distribute the rest of the vaccine? So that is all for us. Let me know if you have any questions. Yes.
Dr. Kingsley and I had for one, that video, I think I did that probably about 15 years ago when I was at Independence Health Department. But Dr. Kingsley and I talked just a little about this year's flu vaccine. And, you know, he had said, do you know how they come up with the formulation for the flu vaccine? And I didn't know exactly where he was going, but, you know, every year they kind of, because the Southern Hemisphere and the Northern Hemisphere, they're in their summer now and we're in our winter. So they kind of, the scientists always look at what flu strains, and this year it wasn't a great match, but it's always, you know, even right now the CDC is saying, you know, having a flu shot is still going to provide some protection. So we are still going to be trying to go out and look for opportunities that we have quite a bit of flu vaccine left. So we are still looking for opportunities to give it out, and it's not too late.
When the CDC and the NIH and WHO, they go out and they try to figure out what the circulating flu viruses will be, they're doing it like 6 months in advance because they have to have the time to be able to actually make the vaccine so they can, you know, mass circulate it out to the public. And so during that time, the viruses that they think that are going to be spreading all over the world, those can just disappear and a whole new virus could show up. And then, whoops, you got the wrong serotype for the virus that's in the community when the winter hits. But most of the time, they're pretty close. But like this year, it's not optimal, but it's still better than nothing.
Yeah, well, they still have to base those off of like some additional algorithms afterwards on anticipated mutations that it'll make and stuff like that. So it's also like, you know, it's always going to be difficult to anticipate like a bullseye every time. But that is one of the things too. I like to.
It's a crapshoot, but most of the time they're pretty close.
Yeah. That's why I do like to talk to my patients at least about that. It's not like, you know, I'll be like, oh, they really missed on this one. And I'm like, it's not a miss. It's just like not a bullseye. I'm like, we'll cut darts and stuff. Like it's not a bullseye, but you know, we hit the board. Like you should a little bit beher with this rather than like it being a complete miss. So that way they don't look at like, oh, well, I just won't get it then because it's a miss. You know.
I'm gonna start using that.
Yeah.
Zach thought it was a miss.
All right, we're down to, thank you, Rebecca. We're down to subcommittee chair. Susan?
Hello there. The finance committee was able to meet this past Tuesday, and our main topic of discussion was the amount of money to put into a CD, to a 6-month, 7-month CD. And a lot of the group had previously to the meeting reviewed like total expenses from January to through June from the years 2015 to 2025 and kind of looked at those expenses and then looked at what amount of money we could kind of let go for a little bit to make a little extra money for the health department to put in that CD without using too much that we would need for our expenses. And we came up to utilize, kind of voted on or proposing that we take 250,000 and put into a 6 or 7 month CD. And we could put it into MOSIP, which Dawn looked up what their rate was as of as of Tuesday was 3.61, I think, percent. And then I think they're also looking at Notaway, or I don't know if it's Notaway or Notaway Bank.
Not away. But
Notaway.
that's my Missouri pronunciation. So who knows?
Okay. And kind of look at what percentage they have too. So I don't know. I think what we're kind of asking for the board is to okay the $250,000 to go into a 6-month or 7-month CD, whatever we can get the highest interest on. And when we looked at that 250,000, it truly is the most conservative. I think there was even a thought of maybe going, it looked like there might be $1 million that we could look at, but we thought for this first round and not to overdo something and have to make amends somehow, we would go low and see what we can do there. So I don't know, Andrew, if you want to add more.
Susan,
Yes.
Susan, so if we do the, let's say 6 months versus 7, whichever one, is there a penalty if we have to break it money out earlier? I mean,
Yes,
or
there would be, I think, for the CD. Yes.
is it pretty painful?
think it was-
That I don't.
Dawn had reached out to Nodaway, and they had said that if we needed to redeem it early, the penalty is 3 months of interest.
Okay. All right. So Andrew, so if let's say we did do more than 250, let's say we did 500,000, would we be caught short in 6 or 7 months with cash?
I wouldn't think so, but we know with 250,000 for sure we would not be. So that's why we were kind of leaning towards 250 was we, for a certainty, there would be no way that we could be caught short. And so I think that's where we were all very conservative. We're like, well, if we know that 250, there's no way we could lose any money.
Right.
And the amounts in the regular money market account, the interest rate is not that much less right at the moment.
Mhm.
So really all we're doing by putting it in a CD is just guaranteeing a little bit for that much longer. Like,
Well,
so
no, you're actually just guaranteed that you have that interest for that 6 or 7 months, as opposed to next week it drops down to 3.2, and then the week after that it's 3.1.
Correct.
right.
Yeah, so, and that's an issue that we're going to have to decide, because whatever the interest rate is this year, I could be wrong. Nobody ever can predict the future, but I'm guessing the interest rate is probably lower next year. So,
Right.
Could be.
So this is probably the best chance we're going to get as good an interest rate that we're going to get for at least, for a few years anyways. I could be wrong. Like I said, I don't want to pretend I know the future, because I don't. So, but the interest rates are trending downward.
Right. So I guess the motion we are looking for is from the board, and we're kind of skipping down. I don't know if
Yeah.
anyone has an issue with us skipping down or we want to wait, but it would be to authorize the director to invest $250,000 in a CD for 6 or 7 months with the best rate with either MOSA or Nodaway Valley.
Is everybody on the board cool with 250, or do you guys want to go more?
I think for the initial time doing it, I think 250, seeing how things go, how we react, if there's any hiccups, any unexpected things, is just a safe way to play it with
Right.
the taxpayers' money.
I agree.
All right, I'm cool with that. All right. So do you want us to do it now, Andrew, or you wait till the end?
I'd say we do it now. It's a matter of discussion now. We've talked about it.
Okay.
So
Pop up the little whatever we're supposed to say.
Well, I don't think
We
we
have-
we didn't
we don't
really
have a little-
do a memo, so.
All right. All right. So Susan, how do you want us to say it?
We propose from the financial committee proposes.
What
Go
I
ahead.
said, Move for
Go
the
ahead.
director to invest $250,000 with Nottaway Valley Bank or MOSA for the best rate for 6 or 7 months with the certificate of deposit.
Yes.
And
I'll
that
make a
can be,
Did someone second that?
Yeah, I did.
well,
Somebody
Okay.
needs to-
So Susan motioned it and then Dr. Kingsley
Okay.
seconded it.
is that good enough, Cindy?
Okay, can we have a vote then? Zach?
Yep.
Zach's yes.
Kim's yes. Dr. Kingsley?
Yes.
Susan, yes.
Right. All right, down to financial report or review and approval of bills.
Just review and approve. the
Okay.
bills.
Entertain a motion to move to approve the bills.
I move that we approve the bills.
I'll
I'll
second
second
that.
it. Okay, Susan will second it.
All right. Go to a vote, Dr. Kingsley,
Yes.
Susan,
Yes.
Zach,
Yes.
Kim is a yes.
No fees, right?
We do have these.
Oh, the other was a females.
Yeah, there were two, Fair and Gold had an increase, in that fee. They went from $75 to, or $73 to 75. And then, Blood HCG went from $8 to $9.
What was the first one?
The Fair and Gold,
Okay. That's the TV one, right?
Right.
So do we need a motion to accept the changes in the fee? Okay.
Yeah, I move that we accept the fee resolutions for Interferon Gold and what was the other one?
Blood Draw, HCG.
HCG blood draw.
I'll second that.
Well, second.
We all did, yeah.
So just for Cindy Cogan, I do need to know who officially seconded.
We can say Susan did that.
Okay.
Okay.
I'm not gonna fight with her over that. Go to vote.
You could have it, Kim.
Susan, you want it.
Dr. Kingsley, we're gonna go to a vote.
Yes.
Susan,
Yes.
Zach,
Yes.
Kim is a yes. Okay. And the next on the agenda is the most allocation. We just discussed that, right?
Yeah.
Okay.
Mhm.
All right. Anything else that we need to discuss?
The only thing I'd say is we are closed on Monday, so the health department will not be open.
That's President's Day or something, right? What is
Martin
that?
Luther King.
Martin Luther King Day. All right. Cool.
And I think that is,
Okay, well,
That's it.
I'll make a motion to end the meeting.
Okay, next meeting is February 19th at 6 p.m.
I'll second it.
All right, go to vote. Dr. Kingsley,
Yes.
Susan,
Susan, yes.
Zach,
Yes.
Kim is a yes.
Okay, everybody, thank you. Hopefully I'll see you guys next month.
Bye.
Bye.
Thank you, everyone. Great meeting.